So, a few years ago, we took the best basketball players in the world. We put them out on the court in the Olympics, and they got whooped by the Albanians or something. Remember that? I mean, what was that about? We have the best partialists, I think, in the world here. I mean, we've trained people to do livers like nobody else. We've trained them to do hearts like nobody else. I mean, the Yakuza from Japan fly here to get their livers done, right? But it's like the basketball team in the Olympics. They don't know how to play together. They can't coordinate. They don't talk to each other. There's not a plan. There's not a master planner. There's not a project manager. You know, there's no adult supervision. I don't want to buy that care anymore. I'm not going to buy that care anymore. You know, we were just up at Harvard talking to the folks at Partners, and you know, a bunch of us, large companies, and we said, you know, unless you begin to migrate to a medical home, unless you begin to have a plan for doing the basics and doing it well, you know, you're not getting another cent from us, right? So yesterday I got an email from the guy now in charge of designing that because they want to keep our business. And the email says, you know, we think we're a fine-tuned Ferrari, but we're going in the wrong direction, you know? I loved it. So the other thing is that, you know, we absolutely, this is a quote from George Halverson, the CEO of Geisinger, I mean of Kaiser, and I love it. You know, there are places, when I do data, there are places, again, when I adjust for age, when I adjust for other complications, there are places where I see 1/3 less invasive procedures because I need to see 1/3 less because somebody's paying attention to the details. I have populations where we have a robust system of primary care, the Grand Junctions of the Colorado, the Dubuques, Iowa, right? You know, here in Green Bay, I think, you know, you really have that. And you have the potential, because what I see here, you know, in looking at what's happening with Bellin and their development of the medical home, I really see the potential for that to really, for you to be very competitive in this marketplace of where companies are going to move jobs to. So for us as large buyers of care, it's back to 1910. This is the Flexner report that changed the medical system, where we saw disparities between how hospitals were delivering cares, how academic medical centers were teaching. You know, we closed 94 out of the 160 hospitals, medical schools. I mean, we're back there. We're back there as society. We're in that place. So as a large buyer of care, about 4 years ago, I sat around the pool with my SVP of HR, my CEO at his house, and we talked about this dilemma, right? And by the way, my CEO is keeping the White House's feet to the fire, right? You saw him on the news the other day talking about that, and he's going to keep talking about it. I mean, you got to stay focused on this transformation. You can't lose the focus. It isn't just about access. It's about us buying something other than the garbage we buy now, right? I mean, if we just put more people in the system to buy the same garbage, you know, we still are selling garbage, right? So we began to ask ourselves some fundamental questions. And one of the questions we asked ourselves was, what's the most important element? What's the basic foundation of a system that works and delivers value? What is it that we're doing right and what is it we're doing wrong? And when you look around the world and you look here at those places where we get good care, what we find underneath that, the basic foundation of that, is a healing relationship of trust between our employees and their healer, their primary care physician. You know, when we have that, when we do the data and look at that, if that's just the basis, when I ask my employees, do you have a meaningful relationship with a comprehensivist, somebody who delivers comprehensive care to you, and that's your normal source of care, When I do surveys and I look at my population and I find that element, it costs me 1/3 less money in that population. They have a 19% lower mortality. They are 19% less likely to be that percentage of people who die between 45 and 60. They are 12% less likely to be obese, and they're 7% less likely to smoke. And yet, as a buyer of care, I have done everything in my power in the last 20 years to disintermediate that. Right? I will change my plan to save a nickel, even if it means my employees who had a relationship with somebody don't anymore, right? We stop that. We're going to stop that. We're going to change the way we buy. So as a buyer of care now, I pay first dollar for primary care, no cost, nothing out of pocket as part of my design, right? I incent that doctor-patient relationship by paying my employees $150 to take their health risk assessment in and go over it with their primary care doc. Why? Because I want to establish a relationship between them and their primary doc. What does that mean for me in a trusting relationship? It means for me that they're going to have, at least beginning to have a conversation with somebody they trust about, is this procedure really necessary? Is this likely to do me more harm than good? Right? We have places now in America where, when I look at my data, when certain procedures are recommended to that population, we tell them to get the hell out of Dodge, right? We offer them another opinion, another option, to go to Cleveland Clinic or go to Mayo or somewhere, because some places we see, 3 times as much back surgery or 3 times as much heart surgery. In Wichita, Kansas, where we have the second highest rate of invasive stents, right? Because there's 3 institutes of cardiology that have emerged there. We find that 70% of the people we send out are told they don't need the procedure that's recommended there. 70%. It's become a milking machine. Our body parts for our employees are an ATM machine in many systems now. McAllen, Texas, read it. The cost conundrum, read it. It's very powerful. So this is the reason why we think that you want to incent a doctor-patient healing relationship, why you want to have a robust system of primary care, because there's built into our brains a need to have a healer. I grew up in Africa. I understand the value of the traditional healer. I mean, it's hardwired in there. I mean, we seek out healers in our society. We've always elevated them to positions of authority. We're very lucky as healers to be in that role. We're all going to get sick. We're all going to die. And when you do a functional MRI of the thought process of that, it isn't the part of the brain that decides between an apple and an orange or a Ford and a Chevy, right? It's up there in the part of the brain that decides about your religious experience. I mean, it's, you dig up the ruins from 40,000 years ago, the mother goddess. I mean, every society has had healers. Every society has needed to have healers. So consequently, they become the second most valued member, the most trusted member of society. First your family, then your healer. So why would I want to disintermediate that? Why would I not want to do everything I could to amplify and cadence that? Why would I not want to work with the primary care providers as an employer and develop plans around, how do I really get at amplifying and cadence a message of health that I do in my wellness programs, right? We spend, a bunch of money in our wellness program. We get a great return on that, by the way. We spent $98 million the last 5 years. We got a return of $198 million. That's not including productivity. That's just lowering the number of risk factors in our population. But that's health. Health care or sick care, what I buy, right, is what we're talking about here today. I would at least like to pay the primary care providers to amplify and cadence the message of health that I deliver, right? So, when you talk about integrating, your employees into a program and developing a trusting relationship in that program, you begin to amplify and cadence your wellness message. It'll save you money, honest. It'll save you money. So this is what the current administration is viewing this as. And by the way, I have a tape from Newt Gingrich saying the same thing. So it's not a political issue, right? I would love to show you that tape. In fact, if you like, I can send it to you. You can show it around. Where he says the patient-centered medical home is the single most important thing we can do in society, right? To transform away from an episode-based, uncoordinated, disintegrated system of care to an integrated primary care-based where you have real relationships at the base of the care that you deliver. So, huge move in that direction by our federal government. The DoD is investing $1.8 billion so that every DoD member has a medical home. The VA is completely transforming itself so that every VA member has a medical home, and they have a timeline. It's 2013. I mean, they're really moving the system. The VA has done a phenomenal job. They've taken 71% of the inefficiency out of it. They've really, and when I survey my employees, believe it or not, because I trained in medical schools that were affiliated with the VA, like many of us did, and to see that now, my employees, when I survey them, and I say, how happy are you about the care that you get? Who do you get your care from? My highest rating comes from those who are lucky enough to have the VA system.